Hey, welcome to the channel. I'm Fortney, and I'm forging my way towards the finish line in the fourth quarter of life, posting videos along the way. But now my problem is I'm not forging quite as easily as I used to. Got some knee issues, like many of you out there might have knee issues. So I'm going to let you know what my situation is, and I hope that you'll take a few minutes to comment on your situation. Now, I've always had bad knees. I mean, I've always had at least one bad knee. When I was 19, I injured my left knee fairly seriously, dislocated the kneecap 90 degrees to the left, tore a lot of things in there, and it took me quite a while to recover from that. Now, they were still drafting people back then, and I went to be drafted in April of '70. And they looked at my knee and they said, we can't use you like that. You're going to have to get it repaired, and then we're going to draft you in 6 months. And we didn't have any medical insurance, or I didn't have any money for an operation or anything like that. So I said, well, just draft me. You have orthopedic surgeons, fix the knee, and tack whatever time it took for recovery on to the 2 years. And naturally, I never heard from them again, because once you damage a knee like that, it's not going to be stand up to the marching and everything else in boot camp. So I never heard from them again. So at the time, I just worked through it. It would swell up and go down, and eventually it got to the point where it was just stiff, and I could walk with it and work with it, earn a living with it, even jog with it, things like that. It just became a chronic thing. Kind of like a three-legged dog. They get along pretty good, but they're not 100%. So I worked with that for the longest period of time, and all my life I've always worked at strenuous jobs, and my right leg probably always did 60 or 65% of the work, and my left leg just did 30%. But working together, the two of them, I did whatever I had to do. So that's how it was throughout my entire life, my entire career. And so now here I am at 75, and I'm still working. I work in healthcare. I work because I want to and not necessarily because I have to. Very busy, very active. I get about 15 or 17,000 steps in a day. And it's nonstop, on my feet all day long. It's a running joke when I sit down. People say, oh, look, Fortney's sitting down. So I'm always busy, always moving. Now, about 13 months ago, my right knee, my good knee, I started to get like a twinge or a pain in it. And it was like, I thought to myself, oh boy, now what? But I figured it was just overexertion and that it would pass. But I was wrong, and I was going upstairs and pop. Something popped on the right outside of my knee, and it put me on the floor. I had to go on crutches for a couple days. I had to take 3 weeks off of work, and I had a lot of pain. Went to the orthopedic doctor, and they said, you tore a meniscus in your knee, and when do you want to come in for a knee replacement? Because meniscus surgery at your age isn't worth it. So I told him I'd give that some thought and get back to him. Because in my case, it wouldn't be just a single knee replacement. It would be a double knee replacement. Because the other knee, whenever I thought about knee replacements, and it wasn't too often, it was always I'd get the left knee replaced, the one I injured when I was 19. But that now, that's my good knee, and now my good knee is my bad knee. So it's it really kind of threw me for a loop. What it did for me, it made me feel instantly old. I had to reassess everything. I could no longer trust myself on going up on ladders. I had to have help to go up and clean my gutters out. And that was a big departure for me, because up until recently, I'd be going up there my ladder myself, cleaning them out, because I could always trust my good leg, but now I can't trust my good leg, and I could fall off the ladder. It could be a life-changing event, and I can't take the risk. It's it was a humbling experience. Something simple like going up and down stairs. I mean, I've always been a little careful because of my left leg, but now I had to be real careful because of both my knees. So I go up and down the stairs one step at a time, holding onto the railing, and it's quite a loss of function there. And my mind wants to rebel against that. Because, when you get old like me, we always think that we're a whole lot younger than we really are, but the body knows better. So I've had to really come to terms with a few things here. I can't get up on tall ladders anymore. I can't go up and down stairs like I want to. Getting up and down on the floor is pretty difficult. I mean, I can still do it to get down there and do exercises and things like that, and yet it's not pretty. Not like when I was a younger man, I could get up and get right back down. Now I have to have something to grab onto and hold onto. And I wonder about my expectations. I think maybe my expectations are too high at 75. Because if I was having these issues at 45, I would think things are really in bad shape. But since I've never been 75 before and I'm in kind of uncharted territory, maybe my expectations are too high. I don't know. So the prospect of a double knee replacement is not something that I'm looking forward to or even entertaining at this point. Now that could change if one of my knees blows up and there's no turning back. Because when I look at people online, they talk about unrelenting knee pain and it was so bad that they had to be on opioids and things like that. That's really not the situation with me. My situation is more that I just am having a hard time with coming to terms with the loss of function. And the fact that I have to stay off ladders, and I have to be careful on stairs, and I have to be careful getting up and down. And I think if I come to terms with that, then the impotence to get these knees replaced won't be there. Because I've looked at all the statistics online, and 80 to 90% success rate, and the implants hold up for 15 or 20 years. And very rarely do you have to have a revision where they go back in and change, redo it. But there is a nagging like 5 to 20% that are dissatisfied with the results. That could be because their expectations were too high, or that could be because of pains after the surgery, a number of things. There's always 2% or so can get a systemic infection or get an infection where they have to go in and clean that infection out and redo the operation. And so these are small percentages, and yet they are real percentages. They also have to, there's a chance you could throw a blood clot after the surgery and become an emboli, a pulmonary embolism, a PE, or a stroke. So they put you on blood thinners prophylactically, and even that can have side effects. So there's a lot of things to consider, and what I'm thinking now is that unless there's any major change in my knees and my function, my ability to do things, I think I'm going to hold off on any replacements for now. Although I could be talked into it. So what I'm hoping is that in your comments below, you'll tell me your experience. I'm particularly interested. I'd be grateful to hear from anybody, but I'd be particularly interested to hear from people with double knee replacements. How's your functionality? How's your ability on stairs? How easy is it for you to get up and down off the floor? Do you keep yourself off of ladders, or are you right back up at the top of that ladder? I'd really appreciate hearing just a comment. It doesn't have to be a big, I know you're busy, it doesn't have to be a big paragraph or anything like that, but just a couple sentences or two, just let me know how you did, what your recommendation would be, and I'd really appreciate it. So that's about it for now, and as of now, I've talked myself out of it, but if you can talk me into it, I'd love to hear from you down below. And there's a couple other videos on the site here. Check them out if you're interested. If this video resonates with you, give it a like. And I appreciate any comments you might put in there, positive or negative. You won't hurt my feelings. Don't pull any punches. So this is Fortney asking you to check back, let's interact, and always remember, God has your back.